Malaria is caused by a parasite, a tiny, single-celled organism in the blood vessels and livers of human beings. It's a serious disease that disables and kills more than 860,000 people every year. Though 40% of the world's population live in malaria-endemic regions, the majority of related deaths occur in sub-Saharan Africa. And despite medical advances, the disease continues to be a problem. It is estimated that every 45 seconds, a child dies from malaria in Africa. But there is hope that one day malaria will no longer burden the people of Africa. Angela and Regina both have daughters infected with malaria. These mothers have come to the Shampande Clinic in southern Zambia to receive medication. Supplying effective drugs within Africa is a challenge. Regina and Angela desperately hope to find treatments for their suffering daughters.
Children are one of the most vulnerable population to malaria. As you know, in many parts of Africa, people do not easily access drugs in the public sector. They would have to walk miles before they find a public structure.
One of the biggest problems in Africa is lack of health education, which can lead to a lack of malaria diagnosis and treatment. Every year, the continent loses an estimated $12 billion in gross domestic product due directly to the disease.
What we are facing is not just a lack of drugs, not just a lack of nurses, a lack of an efficient distribution system. It is fundamental in the health education, the education overall, but the health education of people, and then make sure people get access. Drugs are available, but they need to reach the patients.
With inconsistent availability of treatments, mothers like Regina and Angela can only wait and hope for the arrival of effective drugs for their daughters.
It is essential that children are helped being prevented from getting malaria by having them sleep under bed nets. If a child is sick, they would need the appropriate drug that is adapted to the body weight of the child.
Through the continuing efforts of people on 4 continents, some patients are lucky. Mothers Angela and Regina finally receive much-needed treatments for their daughters.